stay put and not infect anybody else. Home isolate. If you need testing, there are labs that do home testing, and there are some LGUs that do home testing as well. So if you're having difficulty getting a test or ubod ng haba ng pila, the other option, if you only have mild symptoms, is to do telemedicine. Try to get tested at home so that you don't expose anybody. And if you really can't get a test but you have symptoms, just isolate for 10 days para wala na tayong ibang mahawahan. We'll do our best to really test, but the numbers are really staggering right now. Even the US is having huge backlogs among their states because so many people have symptoms. And whether you're tested or not naman, if you're fully vaccinated, chances are it's gonna go away on its own. And you just have to watch out for the warning signs. And of course, there's a lot of telemed available, and of course, the DOH hotlines.
Mm-hmm. Thank you, Dr. Salvayan. Sir, just sabay ko na rin din po yung question for you because we're seeing reports of several people getting sick and meron din pong reports na nagkakaubusan daw po at least ng mga branded na go-to treatments for flu or for whatever sickness we have, common sickness that we have. Where do we attribute this seeming increasing number of people getting sick, and how are we going to how do we know if we should get tested already? Paano po natin siya i-differentiate from a regular flu or kung possibly COVID candidate, sir?
Yeah, that's really the problem. There's really no good differentiation among the symptoms. And in fact, 40% of Omicron is going to be asymptomatic. So that's why if you have exposure, better to quarantine. If you have symptoms, better to isolate. It's important, you can have symptomatic relief. The symptomatic relief is great for being able to sleep. But they're not antivirals. So they're not going to add much in terms of how fast you're going to get better or not. There are generic equivalents. A lot of people like branded kasi, but paracetamol's been around for tens and tens of years. So it's not like it's a new drug. So the other generic equivalents, as long as they're FDA cleared, are just fine. But I think the important thing talaga is again yung isolation, because when we expose people, just because you don't have a test doesn't mean you can't get other people sick. And it is flu season, and we had a lot of people go around during the holidays. So whether it was COVID or kung flu lang or even sipon ubo, dadami talaga bigla yan kasi people were more mobile. So right now, the cases are high in the community and we know it's circulating. The best thing to do talaga if you have symptoms is to stay home. If you can get a test, great. If you can't get a test, as long as it's just mild symptoms, just stay home para wala na po kayong ibang mahawa.
Thank you, Dr. Salvania. Sir, I'll just go back to Sec Karlo. Sir, paano po natin plan i-address yung problem sa cost ng testing? Because it appears sa mga reports din po that a lot of people are hesitant to get tested dahil namamahalan pa rin po sa COVID testing. And at the same time, yung iba, takot naman magpa-test at takot na malaman na may COVID-19 sila. So maybe those two things, the cost and the fear of the people, how does the government intend to address that?
I think we should listen to our doctors and our health experts, no? So again, just to remind, if you feel symptomatic, then the best thing to do is to isolate immediately, no? Isolate immediately. Let's assume that it's COVID. Then of course for testing, we can always ask the help of the LGUs. No, we're constantly also coordinating with the LGUs, and the LGUs are the ones on the ground. At sinasabi naman po namin na pag symptomatic at kailangan i-test, i-cover naman ng PhilHealth yan. And then the LGUs also, they have their own also ways of testing, So all of these things, all of these options are available sa ating mga kababayan. But again, let's listen to our health experts. If you're symptomatic, if you feel symptoms, isolate agad. And then try to get a test. Then we'll work hard to get you tested immediately so that we can confirm whether or not it's Omicron. But you need to also avail of the services ng ating telemedicine. You need to avail of the services ng LGUs as well.
All right. Thank you very much, Cabsec. Thank you, Dr. Salvania.
Thank you. I just like to again emphasize, vaccinate. Thank you. Let's go back to Yusek Rocky.
Yes, thank you, Sec Karlo. Tanong po mula kay MJ Blanca Flor ng Daily Tribune. For Yusek Malaya, if 2 policemen will be deployed to each quarantine hotels following President Duterte's directive, ilan in total ang PNP personnel who will guard the said facilities? Kakayanin po ba daw ng manpower ito ng PNP?
Yeah. With the permission of CAPSEC Nograles, sir.
Yes, go ahead, Yusek.
Yes. Ang atin pong numero ng mga quarantine facilities ay 297. No? Iba-iba po ang classification niyan. May mandatory quarantine facility, may stringent quarantine facility, at meron din for seafarers. So, 297 times 2, dahil sabi ng Pangulo ay 2, that means 594 police officers. So, kakayanin naman po natin ito. No? Meron po tayong tinatawag na Mobile Force Battalion na nakatalaga sa NCRPO, sa mga district, police district offices and mga police stations. At yung mga dati po nating kapulisan na naka-assign sa mga checkpoints ay pwede rin pong i-assign ng Philippine National Police sa mga iba't ibang DOT and Bureau of Quarantine accredited quarantine facilities. So, hindi po mahirap on the part of the Philippine National Police to deploy this 594 police officers sa mga quarantine facilities.
Opo. Ang follow-up question po niya, kailan daw po magsisimula yung enforcement, Yusek?
Yes, actually nagsimula na po yung unang naging direktiba ni Secretary Anyo, yung random inspection. December 31 hanggang sa ngayong araw ay nag-random inspection po ang PNP Health Service at ang NCRPO, because instructions were already given by Secretary Ed Anyo. So, facilities, around 50, have already been randomly inspected by the Philippine National Police. Pero po, since bago lang po ito, bigyan po siguro natin ng 1 o 2 araw ang ating kapulisan para mag-assign ng tao. I would expect baka po bukas ay meron na tayong mga pulis na nakatalaga sa quarantine facilities.
Opo. Ang tanong po mula kay Jason Rubrico ng SMN9 News for Yusek Malaya, will there be a timeline kung kailan dapat maipapasa ng mga Metro Manila LGU yung po daw kanilang ordinance ukol sa paglimita sa mga galaw ng mga unvaccinated? Kailan ba ang target na ma-implement ito sa Metro Manila?
Okay, base po doon sa MMDA resolution, tungkol dito sa regulating the mobility of unvaccinated individuals, na alinsunod din naman sa IATF resolution, ay they urge the different local government units to pass the respective ordinance. Pero wala naman pong nakalagay doon na petsa kung saan kailangan ay naipasa na yung ordinansang ito. Ang advice po sa amin ay merong tinatawag na uniform ordinance na dinadraft ngayon ang MMDA at ang Technical Working Group para ibigay sa iba't ibang mga konseho para ito ay maipasa bilang ordinansa. But I would think na given na sa alert level 3 tayo at kailangan na natin ito, ay siguro naman bibilisan ng mga iba't ibang konseho ang pagpasa nitong ordinansa. So baka po sa susunod na linggo ay meron na tayong makitang ordinansang naipasa. Kasi syempre that is a legislative process. Kailangan dumaan po yan sa proper procedure na nakasaad sa local government code.
Thank you, Yusek Malaya.
Thank you.
Thank you, Yusek Malaya.
Thank you.
Sec Karlo.
Thank you, Yusek Rocky. Thank you, Yusek Malaya. Let's now go to Pia Granada from Rappler.
Hi, good afternoon. Very quickly before my questions, my main questions. For Yusek Malaya, sir, yung 297 quarantine facilities, is this nationwide or just in NCR?
Let me check, no? But kasi this is the list that was given to me by the Bureau of Quarantine. It looks like it's hindi ako nakapaghanda sa tanong mo. Okay, I have the list now. This is Metro Manila. It's Metro Manila. So we still have quarantine facilities outside of Metro Manila. So mas madami po ito. And the directive of the President is not limited to NCR, it's entire country. So we will also deploy police personnel in the quarantine facilities outside of NCR.
And we have enough manpower for that.
Yes, we do. As I mentioned, there's mobile force battalions and mobile force units in every district, province, and region of the country. At doon tayo kumukuha ng mga additional na tao sa mga ganitong public health emergencies and disasters.
All right. And then for Cabinet Secretary Nograles, sir, we already saw earlier that the DOT revoked the accreditation of Berjaya Makati Hotel. But given the President's remarks yesterday, he sounded like he was absolving all hotels from any legal liability when it comes to violations of mandatory quarantine. Sir, isn't this jumping the gun? And does this mean that other hotels will not be investigated, or even Berjaya Makati will not face any legal cases for the breach and quarantine by the woman?
Well, first of all, cases have already been filed against personnel, the officers of Berjaya. No? Secondly, let's put context, no, in the President's statements in the Talk to the People kagabi. First context was in the light of the physical, the limits of hotel personnel to physically stop or enforce the law. And it was in that context na limited, no, yung maaring gawin ng mga officers or officials or the workers or employees and the manager of the hotel. Given that context na medyo limited, no, yung kayang physical enforcement, kaya po kinakailangan ng police. And that's the reason why the President ordered DILG Secretary Ed Año to ensure that may police personnel tayo to strictly enforce doon sa mga quarantine facilities and isolation facilities natin because of the limits of the employees ng hotel to physically enforce, especially pag naging aggressive na yung what do you call this, the person being quarantined. So
No problem
also in
naman,
that
sir, with
also
the-
in
with
that
the additional
context
deployment of cops, but we're just
also in
concerned
that
about the legal
context
liability.
yung sinasabi rin is that duty bound pa rin, no, yung officials of that hotel or quarantine facility to at the very least report any violations of those who are supposed to be under quarantine. And if there is negligence in the part or hindi ginawa, the omission of the hotel employees or its officers in not reporting. Remember, the key word here is yung pagre-report. Because if the law itself is the Notifiable Diseases Act, no? So nandun yung responsibilities and obligations to report those who violate, particularly so para sa mga quarantine facilities na they're duty bound to at the very least report. In this case, as filed by the CIDG and complainants, wala talagang pagre-report na ginawa. So those are omissions which unfortunately fall under the elements found in the provisions of the law na pinagbabawal, na prohibited acts.
So, Secretary, the President stands corrected. These hotels can be held legally liable for non-reporting. And sir, how will the President's remarks last night affect the investigations into hotels who are involved in the absentee quarantine modus?
You have
Tuloy pa ba
to
po, sir, yung
you have to go
investigation?
back to the conversation between the Secretary of Justice and the President in the Talk to the People, and that was very transparent. And in that conversation, the President agreed, no? And then na-emphasize niya lang yung limitation ng physical enforcement, lalo na pag naging aggressive na yung magva-violate ng quarantine. So that's why you need a law enforcer there in order to prevent such aggression or such violations because of the limitations nga of these employees of the hotel. It does not remove or absolve them of their negligence, the omissions of their act, the non-reporting, and in any case, the cases will be filed, the cases will be prosecuted, and then it will be up to the judge to decide.
Okay. Last question, Secretary. Just further on the recommendation of Dr. John Wong about antigen testing. Sir, will the IATF consider subsidizing antigen testing the way that some other governments do that make it more accessible and affordable to the public, lalo na yung home testing?
This is something that's consistently being discussed, especially in light of this Omicron. And again, we're looking at different options for us, for the national government, for the LGUs, and even for private individuals. Again, it has to pass through FDA. FDA has to approve. We have to have our health experts to chime in, just to make sure, and the reason for this is we have to make sure that the tests being used don't give false negatives or even false positives. Diba? So it has to pass through this rigorous process with the health experts, the FDA chiming in, the DOH, and then obviously the IATF will have to make a decision about increasing the options for testing for our population.
Sir, why only now, 2 years into the pandemic? Other countries have very formalized, institutionalized protocols on home testing, antigen, and subsidizing antigen test kits. How come we're only doing this now, studying this matter?
No, it's something
now?
that we always consistently study naman. It's always something that's consistently on the table sa IATF. But we're always looking at the RT-PCR as a gold standard, remember. That's the gold standard. Then we allowed antigen testing, And then as the months go by, there will be more and more test kits available or options for testing in the market, and so we also look at what other countries are doing and what sort of home testing kits that they are actually using. But again, to put it again into context, it's still the RT-PCR that's a gold standard, number one. It's still through RT-PCR that we're able to do genome sequencing. Diba? All the other test kits won't be able for us to determine what type of variant. So under that context, we have the gold standard and we have other testing kits coming out in the market that has to pass through FDA, that has to be studied by our health experts. And again, we don't want to give any false negatives out there because that's also dangerous. So point is, it's always consistently being studied by the IATF and our health experts. And, developments are happening every month as we speak with regard to testing.
Okay. Thank you, Secretary.
Thanks, Pia. Let's go back to you, Sec Rocky.
Yes, thank you, Sec Karlo. Tanong po mula kay Lanes Capanti ng GMA News Online, will religious gatherings included masses be prohibited under alert level 3 areas for amid the rising of COVID-19 cases?
Well, based on our current guidelines, we still allow religious gatherings 30% for alert level 3, 30% for fully vaccinated. But again, the new development right now is itong mga ordinansa na ipapalabas halimbawa ng iba't ibang mga Metro Manila cities and perhaps even in Calabarzon and perhaps in other cities or provinces as well. Baka magpapalabas na rin sila ng mga ordinansa nila with regard to limitations sa movement naman ng mga unvaccinated. But as it stands, the general rule, pag alert level 3 ang lugar, then pag religious gatherings, it's 30% indoors for the fully vaccinated. So yun pa rin po ang sinusundan natin. Special na lang po yung sa pista ng Black Nazarene, which ayaw nga natin ng super spreader event. So kami ay nakikipag-ugnayan din sa Catholic Church na yung mga misa ay gagawin na lang pong online.
Opo. Tanong po ni Lanes Capanti pa rin, will the President issue an executive order regulating prices of self-test antigen kits as well as molnupiravir and Paxlovid to make them more cheap and accessible?
Well, that's something that we will be looking at. Again, as far as FDA is concerned, it has to pass through their regulation. Pagdating dito sa mga antigen kits or self-test kits, as far as molnupiravir and Paxlovid is concerned, I think yung sa Pfizer na Paxlovid, we're still awaiting word from FDA kung meron na po bang nag-ano na ba sila if they went to FDA to apply, no, for an EUA for that for Paxlovid. Sa molnupiravir, I know may mga LGUs din po na who have already purchased or have already secured. Yung sa EO, that's something that I will have to refer to the DOH and the health experts to chime in, no? Before the president even signs an EO, kailangan dumaan po yan sa proseso, and possibly the DOH will have to send its comments with regard to that. I don't know if Dr. Edsel Salvania would like to add anything from what I just said. Dr. Edsel?
Yes, Cabsec. Actually, a lot of these meds, yung like for molnupiravir for Merck and Paxlovid for Pfizer, the companies have already said that at least while nagpa-pandemic, they will minimize lang yung profits from it, and they've actually licensed it to several generic the generic manufacturers. Now it's really up to the generic manufacturers, unfortunately, kung magpapatong pa sila on top of that. So we'll see how it goes, but I think like with the testing sa RT-PCR and other things, I think government naman can make those decisions whether they need to regulate those prices pa.
Opo, Sir Carnel, susunod pong tanong mula kay Jopel Peleño ng DWIC. Same question po sila ni MJ Blanca Flor ng Daily Tribune. Secretary Dizon and 3 other cabinet secretaries recommends that no bakuna, no labas policy of Metro Manila mayors must be implemented in the entire country. May decision na po ba ukol dito ang IATF at kailan ito maipatutupad? Ang follow-up po naman ni Ivan Mayrina dyan ay kung should there be ordinances or will the president issue an executive order?
May meeting po ang IATF tomorrow, and that's one of the possible topics that we will be discussing. As it stands right now, as I mentioned in my opening statement, so far, yung Metro Manila Council ay nagkaroon ng isang resolution. Sila po ay they've come into an agreement. Napagkasunduan po nila na maglalabas sila ng kanilang mga ordinansya. Then the Calabarzon also, Regional Task Force, is also supporting that, and perhaps even the local government units and the provinces under Calabarzon will also come out with their own respective ordinances. Obviously, then for other LGUs as well, it's up to them to decide. But as far as IATF is concerned, we'll probably talk about it tomorrow sa aming IATF full meeting.
Opo. Tanong pa rin po mula kay Ivan Mayrina ng GMA News. Pa-clarify daw po the President's order to barangay captains to arrest unvaccinated individuals who will go out of their residence. Attorney Cayosa, former president of the IBP, said, and I quote, walang batayan yung walang batas o ordinansa na nagbabawal na lumabas. Ang covered ng ordinansa ay ang pagpasok sa mga establishments. Police power dapat may basihan sa batas or ordinansa. Absent any crime, walang basihan para mag-aresto.
Opo, pag lumabas yung ordinance, then when the president was speaking about persons in authority, yung barangay kapitan po is considered a person in authority. So sa konteksto po na yun, pag oras na lumabas na ng ordinance ang isang LGU, halimbawa dito sa Metro Manila, yung mga cities natin dito, dahil napagkasunduan na nga po ng Metro Manila Council na maglalabas ng ordinansya ang mga LGUs dito sa Metro Manila, then ma-enforce na po yan ng ating law enforcement agencies and persons in authority, including the barangay kapitan.
Opo. Yung tanong po ni Miguel Aguana ng GMA News ay nasagot niyo na rin na Sec Karlo about do sa pila sa swab testing. Salamat po.
Thank you, Yusek Rocky, at maraming salamat din po sa ating mga guests, Undersecretary Jonathan Malaya ng DILG, and of course si Dr. Edsel Salvania. Mga kababayan, our experience with COVID-19 has shown us that we can contain this disease with prompt, decisive, and measured action on the part of the national government, our local government units, our communities, our families, and ourselves as individuals. This allowed us to overcome the threat posed by the Delta variant, and this will allow us to overcome the challenges posed by the Omicron variant. Malinaw po na lahat tayo kailangan kumilos na may buong pag-iingat. Mask, hugas, iwas, plus ventilation, plus bakuna. Kung may nararamdaman po kayo, immediately isolate. Mag-home care kung kayo ay may mild disease, lalo na po kung kayo ay fully vaccinated. Ang mga simpleng aksyon na mga ito ay may impact sa kalusugan ng ating mga kamag-anak, kapitbahay at komunidad. These choices, these steps, and these precautions matter. Piliin natin ang ating kaligtasan. Piliin natin ang ating kalusugan. Now, just as before, we need to be mindful of the welfare of others. Kailangan nating magtulungan at maraming salamat po.